Hello, welcome everyone to the Orange County Clerk of Courts Mental Health webinar. It is our mental health or your health matters, mental health awareness during COVID-19. Actually, we're waiting for some attendees to all connect here with us. But it looks like we have everybody that's connecting so far, and we'll have some people join us as we go along. I'm Dane Weister, the Communications Director here for the Office of Tiffany Moore Russell, the Orange County Clerk of Courts. Thank you for joining us. Usually around this time of year, we would do a mental health event. We've done a mental health event out in the community to talk about this very important topic during this month, which is Mental Health Awareness Month. But with these times, of course, this is how we're doing it virtually. And what good timing to share information like this as we're dealing with this pandemic and just so many different things in our lives that have been changed. So we hope you find the information that we provide here today to you as useful. As a reminder, we're going to take questions from our attendees. You can submit questions during the Q&A portion. You'll see the Q&A portion on your screen. But we do ask you to save your questions till the end, towards the end of our webinar, and then we'll get to those questions and try to answer them for you. Also, after we're done with the webinar, we have a survey we'd like you to take. That helps us to give us feedback on how you find the information we're providing to you, how useful it is, and what we could do going forward in the future to provide more free seminars like this. This webinar will be recorded, and we share that with you so that you're aware that it's recorded, and then also we'll be sharing it on our social media pages so you can view it later. So without further ado, I want to introduce to you your Orange County Clerk of Courts, Tiffany Moore Russell, to kick us off.
Hello, everyone. Thank you, Dane, and thank you so much for being here today with us. Your participation here today shows that you understand the importance of mental health awareness as an essential topic to address as we navigate through these ever-changing, unprecedented times due to COVID-19. So first, I want to acknowledge my staff who have worked very hard to bring this webinar to fruition. So thanks to all the staff at the Clerk's Office and Community Outreach for making this happen today. This is actually our first virtual webinar or forum, so I'm glad that we were able to take outreach from the community centers to your homes and your laptops. So one of my office's strategic outreach goals is mental health awareness, and I knew that during a challenging time like this, we needed to bring forth available mental health resources during Mental Health Awareness Month. So even though this is our first webinar, it will not be our last opportunity to do this, as challenges create new opportunities for us to bring you innovative ways to communicate with you. So I also want to acknowledge our panelists who are here today. From the Mental Health Association of Central Florida, Dr. David Cavallari. Can you wave at him, Doc? There you go. From Peer Support Services, Yasmin Flasterstein. And finally, from Aspire, we have Senior Vice President of Residential and HIV Services, Dr. Phil Toll. Thank you all for joining us today. My office, along with these organizations, are here to help you stay safe. My Health Matters webinar is one of the many workshops we do throughout the year to raise awareness on topics related to mental health, domestic violence awareness, and access to justice. Our goal is to provide an avenue for individuals to navigate the community resources available to them. The Orange County Clerk of Courts has been and will continue to be an advocate for mental health. We hope you will find this life-saving information relevant and that you will share it with others. You will hear topics such as dealing with trauma during COVID-19, steps to wellness, and vital information regarding telecounseling. As a reminder, you may ask any questions you would like during the question and answer section on our Zoom screen, and we hope that you will stay to fill out a small survey after the webinar.
Okay, so we're going to move on. So up next, we have Dr. David Cavallari. If you've seen his presentation before on reflections of trauma, it's a great presentation. We asked him to share how this would relate to COVID-19 and what we're going through with this pandemic. So without further ado, with the Mental Health Association of Central Florida, Dr. David Cavallari. David.
Thank you, Dane. I'm here on behalf of the Mental Health Association of Central Florida. The Mental Health Association does a lot of work in the community, particularly with referrals and providing resources to the community and working with other community partners. Some of what we do includes running support groups, offering other things that might be of some benefit to folks. And one of the things that we do is Reflections of Trauma, which is a workshop that we've been doing for about 3.5 years now. It was born out of the Pulse tragedy back in June 2016. And I'm just going to give you a brief overview of some of the highlights from that, and also how that kind of weaves into what we're experiencing currently. So I'm going to briefly just touch on some of the biological aspects of how trauma affects us, because there is something that physiologically happens to us after we've experienced something traumatic. And for a lot of folks right now, in terms of employment, in terms of their emotional well-being, their health, really pretty much everything that can impact them certainly is something that can be tied back into experiencing trauma. And when a person experiences trauma, actual physical things happen to us. And I'm going to make this part very brief so I can get into some of the things that folks may experience after they've experienced something traumatic. So there are 3 parts of the brain that tend to get associated with trauma, particularly the hippocampus, the amygdala, and the prefrontal cortex. I promise this isn't going to be a lecture on physiological psychology. So there are 2 parts of the brain that are really important for survival, the hippocampus and the amygdala. And one of the things that I do want to touch on with hippocampus is its role in remembering things, encoding memories, prepping us for new memories. And for folks who are experiencing COVID-19 right now, in terms of their employment, in terms of their well-being, that it's possible that this could be a reminder of something traumatic that has happened to them in the past. So even though a person may be feeling certain things right now, thinking certain things right now, and not really feeling like they're able to tie it back into something tangible, the brain remembers things that have happened to us in the past, and it's a way to try to protect us. So those 3 parts of the brain that I just mentioned are really designed to help keep us alive. And a couple of them are really kind of more instinctual. The other one is a little bit more rational. But when the rational part of the brain is really being overwhelmed by those parts of the brain that aren't, that are more instinctive, it's really kind of hard to keep things in order, understandably, for someone who's been through something traumatic. And trauma is a very personal experience. So for some people, they experience something and don't feel affected, whereas others do feel affected on a profoundly deep level. So it's important to keep in mind that for everyone, we all are experiencing this differently. For some of us, we may not feel like we're being affected that much by it. And for others, we're feeling very much affected, whether it's going out and trying to go for a walk in the morning, or you turn on your television, or your social media. And for a person who has experienced trauma, it's very possible that just by reading the news, by going onto their social media, by checking in with friends, that they may feel like they are experiencing a little bit of re-traumatization through all of this. So what I want to say really in basic terms is that what we're experiencing right now very much could be conceived by or construed by a lot of people as another traumatic event in their lives, that they may be worrying about paying their rent or their mortgage, or keeping the lights on, or putting food on the table, or finding toilet paper or paper towels or basic necessities. And that a lot of the fear that people are experiencing, and anxiety and depression, and also even feeling suicidal for some folks, is very real and understandable in this time, because we really are designed to be very much social creatures. And having to isolate for an extended period of time can be a very difficult task for folks. So it's important to be mindful of those things. And when it comes to trauma, the brain really doesn't care if you've experienced the trauma or you're experiencing it secondhand from other folks. I've also when just talking about this now, there's something known as complex trauma. So for some folks, it's layers upon layers of trauma. So it could be more than one event or one incident or experience that may lead a person to feeling really isolated, to feeling very alone, to feel very, very sad about what's going on around them. And if folks are spending a lot of time looking at social media or the news, it's understandable why people's fears are going to be a little further heightened. So the brain remembers those things, and as a result, we behave in certain ways after a person has been experienced some kind of trauma. So I'll talk briefly about some of the ways that people may experience trauma, or how they start to kind of manifest that. So for some people, and it's not surprising that for some people who have experienced something traumatic, they may have intrusive thoughts. They may be thinking things over and over again, replaying the event over and over again, or thinking about if they had gone to the grocery store today, or they went to the gas station, if they didn't wash their hands, or feeling that things are hopeless because they feel that things are just incredibly difficult for them right now. Fatigue is another thing. Even though I've talked about the brain being a part of the whole equation when it comes to trauma and particularly COVID, the rest of the body reminds us as well. So for some of us, we may have days where we don't want to get out of bed, we don't want to shower, we don't want to brush our teeth, we don't want to get out of our PJs, or we just are feeling tired all of the time. For other folks, they may be getting headaches, they may be having stomach issues. I can tell you just from talking to some of my friends how some of them have really had some major stomach issues. Just as something as simple as using the restroom is a problem for some folks. So for folks who are experiencing that, that's your body telling you that things are kind of awry right now, and it's okay for that. I mean, it's not okay for you to be feeling that, but I want to reassure you that it's a part of your body trying to make sense of what's going on right now. For some people, they get angry. For some people, they talk negatively about themselves. So they may blame themselves for something, for whatever reason. They may have a hard time concentrating. So for those of us that are still working or able to work, we may experience difficulties trying to focus on the task at hand because there's so many other things kind of ping-ponging around in our brain at the time. I've heard more extreme instances of folks' bodies shutting down on them just from having to get up every day and try to make it through the day. So there are a lot of things that people can experience after they've been through something traumatic, and there really is no timeline for when a person starts to feel or think some of these things. For some people, they start to feel those feelings and thoughts immediately. For others, they start to experience it a little bit later. So there really is no perfect recipe or timeline for when a person starts to feel that things don't feel quite right for them. But there are a lot of ways that folks can feel the impact of something traumatic. And I firmly believe that what we're experiencing right now globally, as well as in our communities, is something traumatic. And it could be a sense of loss. It could be a sense of connection to others, feeling isolated from people. It's very, very much a part of human nature to want to be around other people. And this is really hard for folks to experience and live through. So it's okay if folks start to feel some of these things. And it's important also that when you recognize it, that a person tries to do something to address it. So I want to give a couple of ideas, things that folks can do to help kind of make it through this period. And I know that Yasmin will be talking about it. I know Dr. Toll will be talking about some of these things as well. But one of the things that I talk about, particularly in the Reflections of Trauma workshop, the extended version, is something called grounding techniques. And a grounding technique is simply something that brings you back into the present moment. Because for some folks who really kind of find themselves caught in a moment where they are thinking certain things, they're feeling certain things, that they're having a hard time kind of staying here and now in the present moment. That for some folks, something like physical touch, such as holding someone's hand, or if you have a pet, uh, petting your dog or your cat, or if you have a child, hugging your child, or if you have a partner, holding their hand. For some people, a scent or a smell. Oftentimes during my workshop, I bring some essential oils, and for some folks, the smell of lavender is something that really helps soothe them, or rose, or Nepali, or even clove for some individuals. For some people, it also helps them to start counting things in the room. I know that might sound kind of silly, but something as simple as starting to count maybe all of the books that you have in your room, or how many things are on your table, or something up on the ceiling, something to bring you back into the present moment. Another thing I haven't tried yet in any of my workshops, that maybe I will at some point, is to bring ice cubes, because holding something cold is a physical sensation, and having that physical sensation for some people helps bring them back. And when I'm talking about being in the moment, it's not a matter of not acknowledging that feeling. It's not getting so wrapped up in it that you're not able to function on some level. Doing a body scan is another great way that folks can help bring them back into the present moment. It may be just taking their hand and putting it on their stomach and feeling themselves breathing. It's amazing how when folks are in the middle of something, or they're caught up in a moment, that they have difficulty with breathing. So something as simple as just feeling your breath and trying to slow your breath down can really be very helpful and soothing for individuals. So I really am a strong proponent of grounding techniques. It's something that I do in my personal life. I work with clients and talk about some of those strategies. So doing something like that is very helpful. In terms of some other things that folks can do, and I come at this as a person in the helping professions. It's very common for folks in the helping professions, or folks who just are, maybe you're that family member or friend who is getting the text message or getting the phone call from friends saying, hey, I need to bend your ear for a little bit. That could also be traumatic for folks over time. That if you're that one friend or family member that's always hearing about all of the difficulties or struggles that people are experiencing, that you may start to kind of wear down because of that. So it's important for folks to do some kind of self-care beyond just the grounding techniques. And usually in my workshops, I ask folks, what are some of the things that folks like to do for self-care? And for me, some of the things that I enjoy doing that help bring peace to me are yoga, reading, trying to do the Sunday New York Times crossword puzzle, although sometimes that may not be the best strategy for me. Cooking is something that I enjoy doing. I also try to garden, although it's a little difficult to do in this climate, but it's something that does bring some peace to me. I also work from home, so sometimes it can be a challenge to separate between work life and home life. So it's important for me to get out from time to time. And even though things are more challenging now because of COVID, I go for walks around my neighborhood, or I will go for a short bike ride. I will do anything and any little thing. Sometimes I will watch television. There is nothing wrong with watching a little bit of TV right now. Although I do really think it's important for folks right now, and I've said this before in some support groups and also with clients, is to try to limit how much exposure you permit yourself to have to the media right now, because of so much information coming out. It seems to be changing on a daily basis, if not faster than that. So that's something that I strongly recommend folks do in these times. And it was something that we recommended right after the Pulse shooting, because there was so much information coming out that for some people it was just too much. It was information overload for some of them. So in terms of talking a little bit more about self-care, And this is something that Yasmin will be able to speak to a little bit more as the co-founder of Peer Support Space, is developing and expanding a support system. One of the things that I think, and I know it's a little bit harder to do right now with COVID-19, is to be able to have face-to-face contact with other folks, at least with them being in your physical presence. But it's important to continue to maintain contact with those people that you care about, checking in with them, letting them know how you're feeling, letting them know how you're doing. Because I think one of the toughest things for folks who've experienced trauma is overcoming that feeling of guilt, of shame, of feeling responsibility for what's happened. And the reality is what's happening right now is something that's happening to all of us on some level. So it's important to have some kind of a support system ready for you. So it can be your friends, it can be a family member or family members, it can be your trivia team if you play trivia, it can be whomever. It could also be in the form of check-in calls, which is something that Peer Support Space offers to individuals. Another thing that the Mental Health Association offers is anxiety and depression support groups right now. We're running those from Monday through Thursday, 2 times a day. So it's important to connect with someone while you're going through this. I really can't stress that enough, that it's important not to experience these things alone, that it's okay to share that with other people and for them to share a little bit of that too, because I think one of the most important things is to remember that you're not alone in all of this. You really aren't. Another thing that I do suggest for self-care, which I think is probably happening a fair amount, is allowing yourself to have a nothing day, to give yourself permission to take it easy for a day. For some people, I know that exercise is something that's incredibly powerful for them when it comes to coping with trauma, with releasing those good chemicals in our bodies, whether it is something intense like going for a run or doing something like a boot camp video or doing yoga. Something like that can be incredibly powerful for folks. For some people, humor is another way that people do self-care. For me, my go-to show is Arrested Development. I could watch that over and over again. I just watched Grace and Frankie, which was fantastic. A little depressing in a couple parts, but for the most part, it was a fantastically written show. So I think humor for some people is incredibly powerful right now, even if it's just watching a doggy video or a cat video or an animal video. Anything like that is really helpful for folks. Other people, communing with nature, worship is also important. I kind of tie those two things in together because for some people, communing with nature is a very spiritual and religious act for them. For others, it could be, even though right now there are restrictions on, or suggested restrictions on worshiping in large groups, that the power of prayer is still something that people rely on. One of the things that people find very soothing is to be able to give their problems up to a higher power, so that way they can feel a little bit more trusting that things are going to be okay. I've mentioned physical touch, and I know that some of the massage and spa places are starting to reopen. I have a hunch that's going to be very popular, especially over the next couple of months as things start to slowly reopen, that physical touch is incredibly powerful for people. For others, art is something that is a fantastic outlet for them. It's a way of expressing how they're feeling, what they're thinking. One of the things that I've heard time and again from some folks is how they may paint, they may sculpt, they may write in a diary. And even though some folks may say, oh wait, diary is something that a teenager writes. Well, it's something that an adult can write too. There's no reason why an adult can't write down their feelings or express their feelings. In therapy, it can be a very powerful act to write down some of those things that maybe you had bottled up. So it could be talking about the feelings that you're experiencing right now, or the thoughts that are going through your head as you're trying to manage everything with what's going on. For some people, meditation is incredibly powerful, whether it is something that they watch on a channel or an app, or something that they do on their own. Another is food and cooking. For some, cooking is not just a matter of feeding, but it's a social act. And I know that's a little bit more challenging right now, but I've heard folks have potluck parties via Zoom or via Skype. So there are a lot of different creative ways that folks can still commune with each other. And food is a very powerful thing for individuals. And for me, just speaking personally, that when I cook for my family, it's not just because I want to feed my children or family members or friends. It's a way that I show love, and it's a way that I can really feel connected to the people that are important around me. And of course, I also want to mention counseling as a possibility for folks when it comes to self-care. I'm a licensed mental health counselor. Dr. Toll is also a licensed mental health counselor. For some people, counseling is a fantastic way for folks to help make sense and understand what's going on and how this may tie back into other things that have happened to them over the course of their life. So counseling is certainly an option for individuals. And I don't want to say it's the only option, because I think there are so many different ways that a person can recover and heal. Another way that I think that's starting to emerge in this community is peer supports. And I know I'm saying that, and I promise, Yasmin, I won't say too much more about what you do, because you need to talk too, but I think that having other people who have lived experiences and being able to connect with them is very important. And I will say something a little bit more about that. And Dr. Toll is very much aware of this. In the HIV community, of which I've worked with for nearly 20 years now, the peer aspect in terms of the HIV community has been tremendous in helping people feel connected, helping people get the care that they need, and living more fulfilling lives. So I can't stress enough how important it is to talk to or engage other folks who have lived it, who have been through it, or who are in the middle of it right now with you, and can sit there with you, even if it's in a virtual sense, to let you know that it's okay to not feel okay right now, and that they're there for you in that regard. So there are a lot of different ways that folks can navigate this experience. And when I was talking about those three parts of the brain earlier, the hippocampus, the amygdala, and the prefrontal cortex, that for folks who have experienced trauma, those parts of the brains actually do start to reduce in size. But for folks who are in recovery and healing, that those parts of the brain actually do revert back to their original size. So the other message that I want to relay from that is that we're not bound to suffer for the rest of our lives. And as difficult as things are right now, it is possible for things to get better. And for those of you that are watching today, for those of you that are watching somewhere down the road, there are a lot of different ways for a person to recover and to live a very happy and meaningful life after something like this. But I personally do believe that we are in the middle of something traumatic, and it's important to recognize that, and that it's okay. It doesn't mean that there's some kind of moral failure on your part, that there's something wrong with you, that when people experience something traumatic, it's a real thing that happens to us, and that it's okay for us to struggle for a while. For some people, they are able to recover relatively quickly. For other folks, it takes a while, and that's okay. Everyone's different, but it's important that you don't do it alone, that you find something that helps you, because there are so many things that can be of benefit to an individual. And I don't pretend to tell any client or anyone in a support group in my line of work to tell them how they have to feel better. That if they have something that's working for them, that isn't causing them some kind of long-term harm, of course, then I am completely supportive of that. So I think there are a lot of different ways that we can navigate this. I do think it will take some time, but I think it's more than possible. So I could keep going on, but I don't want to take anything away from Yasmin, because I honestly could shill for her and for the Mental Health Association. I really want to thank you for having me on today, and I'm happy to, and I'll be sticking around for the rest of the event today to answer any questions or offer any assistance that I can.
Great, yes. Thank you, Dr. David Cavallari. Yeah, so those of us, great presentation. We always appreciate it, good information. And those of us who just joined us, we want you all to know that we are going to take some questions as we get through our presenters here. So you have joined the My Health Matters mental health webinar with the Orange County Clerk of Courts. We thank you for joining us. And again, we're going to take questions towards the end. So if you had questions of David, the Q&A chat, not the chat, but the Q&A function on your screen, that's how we'll be able to take some questions from you during the end of our webinar to answer those for you. So speaking along the lines of what David was sharing with us, support, peer support is very important. So we're going to now turn it over to Yasmin Flasterstein with Peer Support Spaces to share more with us on her organization and how peer support is so important. Yasmin?
Hi, hello. Thank you so much for having me. And David, thank you so much for your presentation. My name is Yasmin Flasterstein. I'm the co-founder and executive director of Peer Support Space. We're a new grassroots organization that started last February. We've provided free mental health services to over 4,000 people since then. Peer Support Space is building diverse peer-led recovery communities. So we are 100% made up of people who have lived experience with mental health challenges, who receive training to use that experience to help others. In a world where mental health is so stigmatized, it's often a lot more approachable to talk to somebody who has been there before. So we're here to fill a gap in the mental health infrastructure. We have a lot of different services. We have community gatherings, which are peer-led support groups. We focus on communities that are most deeply impacted by suicide and other mental health challenges, and that have the least access to quality services, accessible, affordable, culturally competent services. So some of the communities that we focus on include domestic violence survivors, autistic adults, LGBTQ+ individuals, individuals working towards body positivity, aging women, veterans. We currently have 14 different communities that we support and 22 in the works. In addition to our community gatherings, we also have a drop-in center in Kissimmee. It is currently closed due to COVID-19, but this is a place where people can drop in, talk one-on-one with a peer specialist, so an individual that has that lived experience. They don't have to wait a week or a month to talk to their therapist. They can go ahead and talk to somebody right then and there. They can build their support system. Our tagline is "Where Chosen Family Heals Together." A lot of times I relate the LGBTQ+ community and kind of this understanding and this need for chosen family. Because a lot of people come from environments where, you know, I love you as my kid, but I'm just kind of ignoring the fact that you're gay. But the same thing happens with mental health. And it often comes from the best place, but a lot of times if you haven't been through it, you just don't understand. So it's about building a chosen family that understands what it is to live with PTSD, to live with depression, to live with anxiety, a space where it's okay to not be okay, and where people can build their support system. They can get away and have a safe space. We have an introvert room where people aren't allowed to talk to one another and to just be in space with one another. And I think COVID's really outlining why something like that is important. You know, some of us are introverts and, you know, I prefer to stay at home, but I really miss being surrounded by people. And also a space for a recreational center for people to just build their hobbies. A big reason for relapse is often boredom. And it's often really hard to define who you are outside of your depression, outside of your PTSD. So we have cooking classes, gardening classes, learning to make friendship bracelets, all sorts of stuff like that. And then we also have events to destigmatize mental health. I really appreciate everybody that is on this call today. Mental health is so deeply stigmatized, and I think that the best way we can destigmatize mental health is by starting conversations about it. So it feels like this kind of all daunting task. How do we fight mental health stigma? But it really starts like this, by starting conversations. And, mental health stigma is dangerous. And it shows in two forms. There's social stigma, society telling us that we have to be strong, we can't be vulnerable, we have to have it together, or that makes us a bad parent, that makes us a bad friend, that makes us a bad employee. So we have social stigma, and we also have self-stigma, when society tells you so much that you shouldn't talk about your mental health. We don't talk about these things. You should just think positively or pray it away, or something like that. You start to self-stigmatize. And, I don't want to admit that I have depression because I'm stronger than that. I'm better than that. And it's dangerous because it leaves the average person waits a decade before seeking help for mental health struggles. And, we need to kind of break this notion. You wouldn't wait till you broke every single bone in your body before reaching out for help, but we do that with mental health. And we don't need to, because, as Dr. Cavallari said, the brain physically changes when you're exposed to trauma. And when you're exposed to prolonged trauma, it physically changes. And at the end of the day, the brain is just another organ. If your bone in your arm was different, it broke, you wouldn't hesitate to reach out for help. But when your brain is physically changing right now during quarantine, we're under a prolonged period of stress, and that physically changes your brain and your ability to get out of bed and brush your teeth some days. So it's valid, and it's okay to reach out for help. If you take anything from this presentation at all, please know that mental health is real. We all go through it. When we talk about mental health, sometimes we talk about mental illness in a way that's very those people, that happens to those people, those crazy people. But mental illness aside, we all have mental health. A peer support space doesn't just help the mentally ill. We help everybody overcoming obstacles to mental wellness. Because, grief isn't a mental illness, trauma isn't a mental illness, but this all affects us. Quarantine in some way or another is affecting us. We're experiencing job loss, we're experiencing financial insecurity, we're experiencing isolation, we're experiencing suddenly having to be a teacher, on top of working. So there's so much that we're experiencing. It takes a toll on our mental health because we're people. But because of stigma, we all suffer in silence. And then we think we're alone because nobody else is talking about it. But the reality is we're all struggling right now. This is a really, really hard time. So it's okay to use the resources that are available, whether it's at Aspire, Mental Health Association, peer support space. I really want people to know that there is help available, and you are worthy of that help. Since the start of COVID, we began having digital communal gatherings at 12 p.m. and 6 p.m. each day, Monday to Saturday. Those are available to anybody. We've had over 125 calls in that time with over 900 participants. And time again, people share how they're struggling, and then they apologize and they say, well, other people have it worse. And while it is important to realize that there are communities that are disproportionately affected by COVID, whatever you're going through is valid, and you don't need to apologize for it. And those resources that are available, they're not at capacity. They are available, and they are available to you, and you are worth using those services. So I really, really just want people to know that, this is a hard time, and to really validate that it is a hard time. And find what works for you. David, I really appreciate you highlighting that, there's counseling, but there's other stuff too. A lot of people think mental health and they think counseling, medication, and I'm not downing either of those because I do both of them and they help me a lot. But mental health is so much more than that. It's peer services, it's equine therapy, it's gardening, it's saying no more. So find what works for you. And what I found is it tends to be a combination of stuff. It's not just this one thing that works, but it's using peer services and using this. So everybody heals in different ways. Some things that help me, part of what my self-care is saying no more, drinking water. I write on my expo board, did you drink water today? So every time I look in the mirror, I remember to go drink water, because chances are I did not. Calling friends to vent in between calls. Sometimes because I'm very busy, I have to find ways to self-care on the go, find ways to self-care on a budget, going for a quick walk. I'll set 10 minutes aside and say, okay, I'm taking a 10-minute break to scroll through memes. David talked about, humor and humor helping you. I love dark humor. I laugh at stuff that is probably inappropriate and I would not say on here, but that's okay, but I set a time limit. Otherwise I do it for hours. So setting times to do that kind of stuff, spending time in nature, getting outside, setting boundaries. Right now, if you are a helper, you want to reach out to everybody right now, but there's a reality that if you don't take care of yourself, you're not just not helping yourself, you're not helping those people. So I set boundaries with my friends where I say, hey, I want you to reach out to me whenever you need me. I promise to tell you if I don't have the emotional or physical capacity to help you right now, and I want you to do the same for me. And if you never say no, I'm going to stop reaching out to you because I don't believe you and you're a big fat liar. So setting those boundaries, that's healthy to do. And, a good friend is going to want you to set those boundaries for yourself. Self-care can look like a lot of things. People think of self-care and they think of baking cupcakes. I love me a good cupcake, don't get me wrong. But self-care is anything to take care of yourself. It can be physical, stretching, moving your body, doing yoga, making sure you're getting rest. It can be emotional, being self-compassionate, being kind, finding ways to manage your stress. It can be social, again, setting those boundaries, asking for help. Taking a step away from social media or following positive pages. It can be spiritual, spending time alone, meditating, journaling. It can be personal, finding new hobbies. I love the new things that people are coming up with right now. Honoring yourself, space, creating a space in your home that is just for you, no kids allowed, or organizing your space, rearranging your home office. It can be financial, making sure you budget, making sure you pay your bills, setting aside some splurge money when you do budget on, I'm going to spend whatever I want with this money. Or it could be at work, time management, taking breaks, whatever it may be. But what I really want to reiterate is that find what works for you and take care of yourself. When I talk about self-care, a lot of times I talk about radical self-care. We live in a society that tells us we should be martyrs. It admires people that will die for a cause, and it's just not sustainable to do that. So we need to break the notion that we need to be martyrs. We need to be selfless. We need to give all of ourselves, because the best way we can give the most of ourselves, the best way we can show up for ourselves and for others is by taking care of ourselves. So I encourage people not just to self-love, but to radically self-love, like you're dancing alone in your room to a Lizzo song, and just, go in and love yourself because you deserve it. This is a hard time as people talk about social distancing. I encourage people to physically distance, but socially connect. In it being a hard time, I think we need to reframe the expectations we have for ourselves. We all deserve a little bit of compassion right now. We deserve to readjust what productivity means right now. We need to separate our value from our productivity. I think US culture teaches us that your value is based off of your career and how much productivity you have. So setting that aside, readjusting what productivity is right now. For me, I've been making a daily maintenance plan where I make little check boxes, and it includes stuff like brush your teeth, brush your hair, feed your dog. And you know what? Those things are hard for me right now. And they've never been hard for me outside of quarantine, but that's okay. I'm readjusting what productivity means right now. And I'm doing my best to be self-compassionate. Because if you're a logical person, I learned that research shows that those that are self-compassionate actually get more done. So you don't need to not forgive yourself, because you're actually going to get more done if you do forgive yourself. So those are some things, some wellness tools that I hope you all take from this. Really find whatever works for you. Everybody is different, but it's okay to not be okay, and it's okay to reach out for help. And the Mental Health Association is a great resource to find resources. It's a free resource to find resources. So reach out if you do need a therapist or you do need specific resources. Peer support space right now during COVID does have our 12 p.m., 6 p.m. calls Monday to Saturday. We also have a closed Facebook group, peer support space online group. I talked about self-care. There's also communal care. Sometimes we scream, take care of yourself at people, and what they need really is a support system and a whole community of people caring. So that's a space where you can comment about what you're struggling with right now, and people, you know, give comments of advice or whatever you're looking for. And then outside of our daily digital calls, we also have community specific ones. Tonight we're starting Unblocked. It's a group for creative writers, people that heal through writing. We have a group for new or expectant parents. So all sorts of stuff. I really encourage you guys to all check it out and to get involved if you'd like to. And again, thank you for having me, and thank you for starting conversations about mental health.
Thank you, Yasmin. Yes. So what is the way people could find out more about peer support space? What's the easiest way for them to get information? Your website, I assume?
Yeah, the website. So the website is peer, P-E-E-R, supportspace.org. And then at the top, you'll see COVID response, and that has all of our digital resources. And everything's totally free.
Okay, great. Thank you. Great information again. Thank you for being here. Yasmin Flasterstein, who is with Peer Support Space. Now we're going to move on to our final presenter. We have one of the things that, especially this climate that we're in, that is very helpful this day and age is telecounseling. So without further ado, I want to also introduce to you, we have with us Senior Vice President of Residential and HIV Services, Dr. Phil Toll, with Aspire Health Partners, to share more with us. Dr. Toll, or should I call you Dr. Phil?
Dr. Phil's fine. A lot of people enjoy that. So thank you. Very nice to be here this evening. Thank you for inviting me. One point I want to emphasize that Yasmin and Dr. Cavallari both indicated is that sense of prolonged stress. And the importance that ongoing stress, not only looking at today what we're experiencing, but we need to think in terms of what are the long-term impacts of that stress. So we talk about whether that's going to develop into a chronic mental illness or whether that's going to be impacting us in a physical way over a long period of time. So really looking at that possibility of a development of a major medical problem that we're going to be addressing in the future. So telehealth is a great way to intervene at this point in time. So the technology, and many of you may complain if you have teenagers and young children who are glued to their phones and they're looking down at the dinner table and they're not looking up. So that's a negative side of social media and technology. However, the positive side, and I think there are far more greater advantages to the technology, is in this major catastrophic event in our world, we've actually been able to increase access to care through telehealth. So we can think in terms of telehealth, telemedicine, telepsychiatry, telecounseling. But any of you who may have visited a physician recently probably did so on your smartphone or did so on your computer so that they can actually access care. And so what Aspire's been able to do in a very quick period of time is we moved over 65% of our staff into a telecommuting event so that we can actually work from home, keep staff safe, keep clients safe, and still provide the full range of services that Aspire has to offer. And most behavioral health care providers and medical providers have been offering services through telehealth since the beginning of this pandemic. And so, but we've been forced to move into that with the worldwide shutdown. That's really been key. So intervention, as both David and Yasmin have indicated, is so important that the sooner we recognize that there are issues going on and the sooner we intervene, then the greater the opportunity for us to manage those effectively. And a number of ways in which telecounseling and telehealth has been really important. There really are three categories the way that I look at them. Number one is those clients, those individuals with ongoing mental health issues that we knew all along. They've been in treatment, they've been receiving services, maybe they're on medication, maybe they're getting counseling services, and the fear rose very quickly as to how am I going to continue to access those services if I'm quarantined at home and I'm not supposed to be on the road. And so very quickly we were able to shift all of our services with the exception of our acute care and with the exception of our residential services and all of our housing services, which are the programs that remained open and still remain open during this period of time. And we're welcoming and receiving admissions every day. There's been no reduction in the number of admissions. In fact, there's been some increase in the number of admissions, but access has still been there on a face-to-face basis, obviously. Our outpatient services, we shifted with moving clients off property in the telehealth, telecounseling experience. But the first is those that had identified a problem, how can I continue to get care? If I'm getting long-term injectable medications, how can I access that? You can't give me a shot via telecounseling. However, we can do assessments via telecounseling and then bring those clients in that needed to be seen face-to-face. The other piece are those that would typically identify a mental health issue just across the board. You know, it might be coming up with depression, anxiety, marital discord, et cetera, that would have been recognized had COVID-19 not occurred anyway. And so those individuals who have a newly occurring disorder or illness need to be evaluated, assessed, and then treatment plans developed and certainly services provided. Then the other category are those that are going to see increasing levels of mental health, behavioral health care disorders, including substance use, because we know that substance use is on the rise. Increased rates of suicide are on the rise as a direct result of COVID-19. So we have that pool of individuals who are seeing increased levels of mental health concerns as a direct result of COVID-19. Again, it's a pandemic. It's an experience worldwide. You know, when there's other kinds of situations occur, it may be locked into a particular part of the world, and it didn't go to another part of the world, so other resources were available to pool together and to bring them to that area. We're talking worldwide. We're talking about an entire world shutting down that's never been heard of before. And so that level of stress that we've experienced, there's nothing else that's been like it. And so the kinds of things, and Dr. Cavallari were talking about, what do we typically do? What are the things that normally help me to relax? Many of those things haven't been available to us. You want to go to a movie? You can't do that. You want to go bowling? You can't do that. However, it's important to identify what is available for us right here in this experience that is possible within a quarantine or an isolation experience. And the connection that Yasmin's talking about is really key, that supports, and it's great here, and this is wonderful, so reach out and use it. The technology has been made available to us, and in federal government, state government, county government, all have relaxed the parameters around providing healthcare services via a telehealth environment. And that's really been key. All the major medical insurers have done that. Medicaid has done that. Medicare has done that to expand services to be provided in a telehealth setting so that we really can address the issues that our clients are needing to talk about. So that piece has been a phenomenal development. In fact, Aspire has witnessed some increased productivity, believe it or not, increased opportunities for access, decrease in the number of session failure or, you know, not showing up for services. Because let's face it, it's pretty difficult sometimes to get into a physician's office or a counselor's office when you got all these other things going on. And so, you know, even thinking in terms of riding a bus for an hour and a half to get to a location. Now I can pick up, you know, log into my computer if I can, or pick up my smartphone if I can, and engage in a service that saves me a lot of time. And to some degree, also a degree of anonymity, so that I'm not showing up in an office where other people may see me, addressing that stigma. So we're really seeing an increase in the effectiveness of services, and the access to care is really key. For Aspire Health Partners in that telehealth perspective, you know, you can call our main number of 407-875-3700 and hit number 2. That will take you directly to someone who can address issues that may be related specifically to COVID-19. All of our assessments are occurring telehealth. You're not in the office for those assessments, and then directing you to the appropriate level of care. If it's an outpatient level of care that's needed, then working from a telehealth perspective, it's acute care or residential, you're going to be, or detoxification, you're going to be referred into those services, obviously on a face-to-face basis. So I think those things are really important to remember. Now, one of the struggles with telehealth is everyone having access to the equipment, to the technology. And so again, governmental agencies have actually given away free phones, increased the number of minutes, the opportunity to shift phone plans to using a database, you know, the data, and kind of opening that up, even for those that have limited numbers on the government phones, have been expanded and increased. So, you know, we've really come together, you know, and David said, you know, we're in this together. And so we are all in this together, and then brainstorming and thinking outside the box on how we can deliver care in the most comprehensive way that we can, so that there is almost immediate access. Our lines are open 24/7, 7 days a week. You can get those assessments in those same timeframes so that there is no interruption in access to care. I know one of the other things that we wanted to talk about is HIV services, particularly during COVID-19. And one of the frustrations or fears that individuals have is to say, I need care and I need it now. And so for us, again, at Aspire, we offer in HIV-related services, mental health counseling, substance abuse counseling, residential treatment for substance use disorders. We offer medication-assisted treatment for those who are opiate dependent and also HIV-related. We offer that in general as well, but specific programming and funding for HIV and MAT-related services, psychiatric services. We also offer housing services, and then partnering with community partners to offer medical case management on site. Again, that can be occurring through a telehealth experience. So there's been no interruption in those services, and that was really Aspire's goal, is to say that we don't want to interrupt care. So those three pools of individuals, the chronically mentally ill or those already in treatment, addressing those issues, those with new issues that may or may not be related to COVID, just ongoing issues, that immediate access, certainly comprehensive assessment and evaluation, directing you to the appropriate level of care, whether that is medical care with medications as we talked about. Those assessments for medication, believe it or not, are happening via telehealth. First and foremost. The important thing when we talk about stigma in mental health is, as Yasmin related, sometimes it takes up to 10 years to think in terms of reaching out for help when you need it. We want to obviously reduce that and taking away the stigma and making it ready access 24/7 to do those assessments, and then determining on the appropriate level of care that's necessary, and then that follow-up, so that we made that referral. What are your needs and what are your issues? And then from a medication clinic standpoint, the physicians are reaching out telehealth to do those med management appointments, medication management. We've done things, as you well know, electronically. I don't know how many of you had a prescription written by your doctor lately. You don't walk out with a piece of paper. It's automatically electronically sent to the pharmacy, and within 30 minutes you can be picking it up. And that's where we're at today, and that's a great benefit, so that we can increase access, we can increase the comprehensive level of care, and that we really can address the needs where we're at, particularly now when, even though we're opening up the state, we're opening up the county, those of us that don't need to be moving around, we still don't want to be moving around until we really know that we have a handle on the epidemic.
Great, thank you, Dr. Toll. So you mentioned a phone number there, but what's another way people can access Aspire services?
I'm glad you asked that.
Well,
I meant to remind people about our website. We did a couple of things on our website. Our website's always been there, aspirehealthpartners.com. And so you can access our website. And what we did at the very beginning of the pandemic, at least here for Florida, is we created some videos. You'll see me in many of them, talking about a wide variety of topics. You can go to our website. At the very top, it'll say Aspire's response to COVID-19. Click on that, and it'll take you to the number of videos that we have available. I address issues of how to talk to children about COVID-19, how to address the issues of increasing stress and anxiety related to COVID-19, talked about how to maintain healthy relationships during a quarantine or isolation experience, talked about substance use disorders and because we're going to see a rise. Substance use is a form of self-medication, and when we're stressed and when we're anxious, we're struggling with our own emotional or physical discomfort, and as human beings, we want to medicate that. We want it to go away, and so alcohol and drugs. So you're seeing an increase there in use, and then talked about depression in particular, and just ways to access care, and then the kinds of strategies that we can use as both Dr. Cavallari and Yasmin were talking about, those forms of self-help that are going to be great interventions. Telehealth allows you to access the professional services as necessary and to help you sort through what those might really be.
great, thank you very much for the information. So that's Dr. Phil Toll, who is with Aspire Health Partners. And again, we're going to take some questions here. So we're going to get to our Q&A portion of our webinar. So if you have a question, feel free to ask it through that Q&A function that's on your screen there. You'll see a little Q&A in the center of the screen. Ask your question. We'll start compiling those and we'll get some answers for you. We're going to go back to the beginning of our webinar and our workshop, where we're going to provide some more information with you on the services here at the Orange County Clerk of Courts and how we can help you related to mental health with cases that can be filed. So now joining us will be our Assistant Administrator, Joyce Bodwin, who will share some more information with you related to all those services you can access here at the Orange County Clerk of Courts in the courthouse.
Hello, we're going to continue on with our discussion on Baker Act and the services we provide here at the Orange County Clerk of Courts. The Marchman and Baker Acts are state statutes, and as stated earlier, it allows friends, family members, and other concerned citizens to obtain help from someone with a mental health issue or substance abuse problem. The indications are that they are a danger to themselves or others because of their issue and are unwilling to seek help. Anyone can file a Baker Act petition. The customer will come down, in terms of the process that we follow, the customer will come down to the downtown courthouse and fill out the petition, and they will need to pick between whether it is a mental health or a substance abuse related issue. They cannot choose both. It's one or the other in terms of filling out the petition. You really need to be very specific about what has happened in the past 30 to 60 days and why, in great detail, why they pose a danger to themselves or others. After that petition is completed and filed with the clerk's office, that petition is then sent to the judge for review. Once we receive that order from the judge, again, after the judge has reviewed it, we will contact the petitioner in terms of the status of that petition. If the order is denied, a repetition may be filed after 5 days. If the order is approved by the judge, the petitioner can come back down to the courthouse downtown and pick up the packet and take that information to the sheriff's office in room 240 of the courthouse. That order, however, is only good for 7 days. There is a $40 fee that needs to be paid to the sheriff's office in order to, for when taking that information to them to serve the paperwork. Once you receive the paperwork with you receive a non-emergency phone number that can be contacted in case you have follow-up questions. Call that phone number once you've located the ward, and then once you've located the ward, the sheriff will pick up the person and take them to Aspire to be evaluated. And they'll be evaluated there for up to 3 days for mental health if it's filed as mental health, but up to 5 days if it's filed as a substance abuse issue. The facility will keep the petitioner's information, the petitioner informed, of the ward's status. Okay. While at the facility and being evaluated, if the facility determines that the ward does need treatment, they will contact the court and a hearing will be held. Hearings for mental health concerns are held at the facility, downtown courthouse, or they can also be held remotely. Hearings for substance abuse are all held at the facility, downtown courthouse, or remotely as well. Before or once the allotted time for treatment has been completed, the ward may be released or the facility may petition to request more time. The facilities are required to let the court know if the ward is not complying with treatment in any way that has been deemed to be complied to in terms of the order, the specifics of the order. The judge will make the determination on how the case will proceed or move forward once they receive the documentation, if that does occur. Any questions? Are there any questions about our process here at the house for the clerk's office for filing a Marchman or Baker Act petition.
There's a question in the chat box.
Yes, we do have a question there. So thank you, Joyce, for the information she shared. And we do have one question. And again, if you have a question you'd like to ask of any of our panelists, feel free to submit it in. So we're taking a look at this question here. I don't know if everybody can see that on their screen or not. They can, okay. See is have close young adult family that admits to having depression, anxiety, mental instability, but refuses to allow any help after many offers over several years. Seems as if it's a crutch to always have an excuse for their actions rather than taking responsibility, as there seems no desire to truly feel better. Suggestions. So, do we have one of our panelists that be able to help address this question?
I'll be happy to take it.
All right, Dr. Toll.
When you're thinking in terms of adolescence, that's a difficult experience anyway. And so the level of cooperation that adolescents sometimes have can be pretty difficult. If any of you have parented an adolescent or had that experience in your past, you know. So some of the things, that, if they're not a direct danger to themselves or others. And the third actual condition for Baker Act is if without voluntary care, their condition will deteriorate. So for instance, a person who's psychotic. So if they're unable to make a judgment for themselves about whether or not they need help, so they may not be suicidal, they may not be homicidal, but in fact, their condition will deteriorate without voluntary care. That's another reason to Baker Act. And quite honestly, that's what I see actually more often than suicide and homicide. So if the adolescent doesn't meet the criteria, or even any loved one doesn't meet the criteria for a Baker Act, you still can engage in some types of supports. For instance, if there's someone in the life of that individual that is someone they listen to, someone that is encouraging and inspiring, a mentor in their life, you may want to bring them into the situation and kind of talk about the ways in which their depression, anxiety, or whatever the presenting problem is, how that's impacting their life. In clinical terms, we call that motivational interviewing, motivational enhancement therapies. And what that really is saying is, how can we assist you in understanding that this issue in your life is creating barriers to recognizing your full potential? And so that's not an easy thing to do, but kind of harnessing all the resources. Oftentimes you can get someone to agree to come in for that initial assessment and evaluation, and then a professional can work towards engaging them in services and to help them recognize that the things that we can do for them from an intervention perspective can be helpful. Kind of like what Yasmin's talking about is decreasing that stigma. When you think, oh, someone tells you you need help, we think, oh, I'm crazy, they're going to put me away forever. They're going to, put me away and lock, throw away the key, so those are some fears and anxieties that are real. How do we tend to overcome them? This forum is an example of that, providing education to the community to recognize the importance of addressing and dealing with our mental health issues. I hope that helps.
Yeah. So kind of thinking through that and listening to you, like what would be the first step when you're dealing with a situation like this? Meaning, oh, you need help, well, I'm not crazy, but what's the first step to get somebody to realize to take that step?
I think one of the important things is to help educate them about what is mental illness. Let's talk about things like depression, anxiety. When we think in terms of life experiences in general, there are times when those feelings are real and they're the appropriate response to have. Like COVID-19, there ought to be anxiety. With grief and loss, there ought to be depression. So there are a part of our normal emotional experience. It's when they get to be interfering with our ability to manage our daily lives. For instance, for depression, if you're unable to get out of bed, if you're no longer showering, if you're not eating properly, if you're sleeping 24 hours a day, those are things that indicate to you that my life is out of control, my life is not normal. The emotion can be connected to a very real experience. So it's again, an expected outcome, or again, it can be neurochemical, and so you're experiencing depression or anxiety because of neurochemistry, is off, and we can take a look at that. So education is key. Normalizing the experience of mental health. I always say to people, we're in our head, everything's behavioral health care. The way we think, the way we talk, the way we communicate, everything's mental health. And so what's the disruption of that easy flow of things? we want to talk about. So you try to educate them and engage them in the service. All I'm asking you to do is go for an assessment. You know, the other kinds of resources, now school's not in session now, but particularly for adolescents and young people, school is a great resource to reach out. And today with the Parkland shootings, there's money available where licensed mental health counselors and licensed therapists are in the schools providing that care. You know, obviously community agencies, the Mental Health Association with education, peer support centers, that they're available, they're there. And so they're within arm's reach. So again, you're not alone. And then talk about, I mean, for instance, mental health first aid for youth, mental health first aid for adults. Major opportunities to educate lay people about behavioral health care issues and intervene sooner rather than later.
Great, thank you. Very good, good information. So we have another question that's come in, this one for Yasmin. What would the drop-in center look like under normal circumstances? What occurs in a one-on-one session with a peer support specialist? Is it like a counseling session or a general discussion about each person's experiences?
Yeah, thank you so much for asking that. I miss normal times. I feel so far away. But normally at our drop-in center, it's open Monday to Thursday from 11 a.m. to 4 p.m. People can come in. There are scheduled activities. So for example, every Monday we have free HIV testing. We have DD cuddles, which means our therapy dog is present. On Thursdays, we have a gardening workshop. We have a hobby workshop where a community member comes in and teaches a hobby. So there's scheduled stuff each day, Monday to Thursday. And then there's also ongoing stuff. So we have kind of a menu of services. So people can check out canvases and paint supplies. They could check out our self-care library. They could check out all sorts of different materials for activities that they're interested in, or they can meet one-on-one with a peer specialist. So thank you for asking. Talking to a peer specialist is different than talking to a therapist. A lot of times I use the analogy of a therapist. If somebody is walking through the rain, a therapist may help the rain go away. A peer specialist is going to walk with you through the rain. So a peer specialist isn't there to have any answers. They're really somebody that is there to listen with you. Peer services, peer specialists come from a place of mutuality. So there's no power dynamic. I'm no better than you. I'm not going to tell you what to do. I'm not going to give you any advice. I could say some of my own experiences. Well, you know, I went through this and this is what I did or what has helped me. I've seen some people try this. Have you looked at these resources? So they're just somebody there to sit with you and navigate through whatever you're going through. So some things I might do as a peer specialist, somebody wants to reach out to a therapist and they're really anxious. And I might say, okay, let's do the call together. We'll put the call on speaker. I'll put in the phone number and, you know, I'll press dial, but they're going to talk, you know, so it's just somebody to walk you through it. Or if people are looking up mental health resources, they're sitting at the laptop. I'm sitting next to them. So it's really just somebody that is there to walk with you through that journey and to also help connect you with other services. So peer services are not meant to replace traditional clinical services. They're meant to supplement them. They're meant to help connect people to be a stepping stone to other services and to fill gaps. And then we're also at our drop-in center, our goal, we're currently fundraising to open up a overnight peer respite. And what that is going to be is a place where people can actually stay overnight for free for up to 7 days. So right now there's a gap between inpatient and outpatient care. I'm seeing my therapist once a week versus I'm in crisis and I'm inpatient. But people know when they're not doing well and there's not really somewhere for them to go right now. So it's somewhere they could go for free in a home-like non-clinical environment. It's just surrounded by people that have lived experience where people can stay and just get away from home for a little bit before they reach that crisis point. So that preventative piece. And then sustainability. I'm leaving the inpatient services. I'm ready to take my recovery back into my own hands. I'm ready to be the driver of my own recovery, but I'm not quite ready to go home yet. And then that continued sustainability, that continued preventative of now I have this whole support system, this whole chosen family in the community gatherings, in being able to go to the drop-in center.
Great, great information. Thank you, Yasmin. So we have another question you may be able to see on your screen from an anonymous attendee. What would you suggest, and I'm sure everybody feels a little bit this way or has this question. What would you suggest if someone is experiencing fear and anxiety about returning to work with the threat of COVID-19 still being very real, especially for jobs that interact with people all day? And this question's open to anybody on our panel.
I don't mind starting. If Phil,
Great.
you want
Thanks,
to fill in wherever I missed something, but you know, that's something that I think about in terms of how to negotiate that. And that fear and anxiety is very much a real thing. And one, I think it's important for the person to acknowledge that. And I think in addition to that, it's important to have conversations with their supervisors. And it's tough because for some people, they don't really have the choice of saying, oh, I can just not go to work. I can just decide I'm going to quit this job and go do something else. And it's important for the employers, hopefully, to be as understanding as possible and to support the employee as much as they can when it comes to workplace safety, to allaying their concerns or fears, because those fears are very much a real thing. This is not an imaginary experience that we're all having collectively. So I think it's important for employers to try to be as supportive as they possibly can be and to ensure that the workplace is as safe as possible, because for a lot of people, they don't have great choices. They have either I go to work and I possibly get sick, or I don't go to work and I lose my house, I lose where I live, I can't eat. So for a lot of people, they have some really unpleasant choices. And I think the important thing is to try to, as much as they possibly can, express that to their bosses, and also try to ensure as much as they can in collaboration with their employers, or for their employers to take the lead in ensuring that the workplace is as safe as possible for those individuals, and to be flexible with those individuals as much as they can be when it comes to working with individuals. Maybe it means they take a few more breaks during the day to decompress, or they spend a little bit more time just washing their hands or washing their faces, doing things that will help put them at ease. For some folks, maybe it's going out for a short walk or a break in the middle of the workday. Anything and everything that can help that person feel some semblance of security as they go back out into the workplace, because I have a feeling that what's going to happen after things start to calm down, as things start to reopen, is that there's going to be a shift to places like Aspire, to places like Peer Support Space, to places like the Mental Health Association, as the aftermath of all of this, because of the residual trauma that people are experiencing from this. So it's important not just to talk to your employers, but to reach out to folks like us, so that way we can be there for you in whatever capacity you think is going to be beneficial for you.
I think I would also add the communication about reaching out to your employer, and the employer is communicating as to what strategies have we put in place. You know, whether we're assessing everyone that comes through the door, we're taking everybody's temperature. No one can come in without the use of a mask, so that they can see that indeed you really are taking it seriously about protecting the work environment. Aspires, we do a daily group, if you will, where staff can call in. So like David's saying, take a break, you know, call in at 3 o'clock, and we do that 7 days a week. Here's a safe place to talk about your fears and your anxieties. And so that we can really put those into realistic terms and assist them in managing them. Recognizing we're following the CDC guidelines. So if you're in a high-risk group, a high-risk category, client or staff, then maybe we do keep you out a little bit longer, and we can make accommodations if your job allows it to be performed on an ongoing basis. Others came back, maybe you don't come back. Clients who are in a high-risk group, you know, those that are immunocompromised, those that are over the age of 65, we need to be very cognizant of those, and those may be the individuals that we return last as opposed to first. And
Dane, I would love to share as well as encourage people to reach out to their HR director, department in their employer where they work, and find out whether your organization offers EAP services. A lot of organizations offer EAP, and a couple of those sessions are at no cost to the employee. So find out what your employer has available to you for resources, as well if you're feeling that uncertain or you're having those feelings about returning to work.
Absolutely.
Yeah. Oh, great information. Thank you, everyone. We have a couple more questions. So, David, how has your dynamic for your support groups changed by operating remotely? That's our next question.
Yeah, that's been interesting. I run a couple of support groups on a monthly basis. One is a sexual trauma support group, and the other one is a suicide support group. And what I've noticed is that there's something different about not being in the same physical space. And I think part of what some folks have felt is that it isn't quite the same. I'm not going to lie and tell you that, hey, things are easy and simple. What I have found is that the individuals who have been participating for an extended period of time continue to attend as much as they can. But we also have had some new individuals participate. And I think in some respects, at least in a couple of instances, folks have felt because they haven't had to show their face that when they do start talking, they tend to feel a little bit more comfortable sharing a couple of details, at least initially, about what their lived experience was. But it is different. I'm not going to lie and tell you that it's exactly the same, because it isn't the same. I mean, we're making do as best as we can with the situation, but nothing replaces being in the same physical space as another individual. I mean, Yasmin knows this, Dr. Toll knows this. I think we all know this, that there's something different when you've got that physical energy of someone sitting across from you, or you're sitting in a circle and you're just talking about things. But despite that, we're still having folks attend, and people still seem to find some benefit from it. So I'm pretty grateful to those individuals that still come out. But it is a little bit different of a dynamic, but we still try to talk about whatever it is that they're feeling or thinking at the time. Just because the format has changed somewhat doesn't mean that we're not going to be there for each other the best way that we can be.
And David, to give you a chance, how can people access those services?
So basically, they can find out either through the Mental Health Association's Facebook page.
Okay.
They also post the events on Meetup. So if you have the Meetup app, or you have an account on Meetup or Facebook, or I think even on Instagram and Twitter, they publish and put the word out there as much as they can. You can check out their website, and the phone number for the Mental Health Association is 407-898-0110. But if you just check out the website, or you go to the Facebook page, you can still find plenty of information about the services that we do offer.
Great, thank you. Okay, so we have, looks like one more question. It's going to probably take us up to the end of our workshop here. Next question is, do you have any recommendations for healthcare workers that are experiencing trauma on a daily basis through loss of their patients, etc.?
So if I could, one of peer support spaces populations that we help is healing professionals. So there's actually a peer group this Saturday from 1:30 to 3 p.m. It can be found on our website, peersupportspace.org, but it's a space where healthcare professionals can take off their work caps and be people and be vulnerable and share what's going on with their personal life and share the compassion fatigue that they are experiencing right now. David shared earlier how the brain physically changes when you experience trauma. It also physically changes when you hear about trauma. So just validating that it is really hard to be a healthcare professional right now. As much as we talk about, physical healthcare professionals, also mental healthcare professionals are experiencing a lot right now. So taking care of yourself, taking breaks, setting boundaries, readjusting your workload and what that looks like, and connecting with other people in spaces where you feel comfortable being vulnerable. And if you need to reach out for your own professional help and your own therapist or whatever that looks like.
Very good. Thank you. Anybody else want to comment on that? I think that was good summary, good information, Yasmin. So we're getting close to our time limit here. So I just want to see if Clerk Russell has any closing thoughts here for our webinar. Don't know if she's still with us, but
I'm here, Dane.
there she is. All right.
Okay. So first, I want to thank all of our panelists for participating today. Thank you so much for your time and sharing your knowledge to the community. I'm glad that we were able to still host this event in a different platform. But thank you all so much, and thank you for the participants today for your questions and sharing your time with us today. We hope you'll continue to follow us on Facebook, Instagram, and Twitter, as well as our website, which is myorangeclerk.com, for any updates or information. Even if you need to navigate or access our court system, I would encourage you to continue to follow us, because we'll continually give you updated information as far as what's happening with the courts. So Dane, thank you all, and I guess you want to close us out?
Yes.
Okay.
If you can still hear me.
Yes,
I think
can
I'm
hear
still
you.
on. All right, I'm still on. So I just wanted to say thank you, Clerk Russell. Thank you to all our panelists for sharing this information. I mean, they took time out of their schedules, volunteering their time. This is a service to the community that we love to provide. So we hope you found some valuable information out of all this that will help you during this time. And don't forget to take our survey at the end of the session here. So that way we get your feedback, find out what you thought about our webinar here today, and we can get some valuable information going forward on new content and content you'd like to see in the future. So again, thank you. Have a great evening. Thank you, everybody, for joining us.
Bye.
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 Bye, guys. Thank you.